Hello, ladies and gentlemen. Welcome to another episode of the Men to Men podcast. I'm Malik Carey along with my co-host Brett Carroll. Brett, what's going on, man?
Hey, Malik. How you doing, my brother?
I'm good, man. What's happening?
Listen, as we all know, we just celebrated Mother's Day, so I just want to take a minute to shout out, give all the love to all the mothers and grandmothers and godmothers and surrogate mothers out there. Hope everybody had a day that was honoring and a day that they were appreciated, loved, and celebrated.
Yeah, I just want to give a shout out to my mom, man. She's always just been a steady rock in my life. And so happy Mother's Day, Mom. Hope all is well. What's going on? Let's talk about it, man. This is Mental Health Month. What's going on?
Well, last week we talked about we're going to use the month of May because it is Mental Health Month and talk about what mental health is.
Yeah.
I know you want to talk a little bit about mental health, but I think what we want to spend the rest of the month talking about is some of the illnesses that are associated with mental health so we can help our listeners identify the different types of mental health challenges and also the signs and symptoms so that they can seek help as needed.
Yeah, it's something that really has affected our community. And when we talk about mental health, mental health is this new thing that's been going around, but it's been around for years. And a lot of times we do focus on, when we talk about mental health, is the mental illness side of it. But we want people to be mentally healthy. And really what mental health is it includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps us to determine how we handle stress, how we handle relationships, and how we make healthy choices. And one of the things that has been going on for so many years in our communities and across the board, I mean, we see it everywhere now, is really going to get the help. And what mental illness is a condition that causes serious disorders in someone's thinking and or behavior. And mental illness affects every aspect of our life.
Right. No question.
And it is something that is, we're seeing it play out big time with the school shootings and mass shootings and just everything. And for so many years, we called it crazy.
Right.
I want to get away from stigma of crazy. And really, let's address it now. Thank goodness it's been addressed now as what it is. It's mental health and mental illness.
Right.
When we want to move people, we're hoping these podcasts, these next few months and these next few weeks, move people who may be suffering and not really, dealing with it. And it shows up in many ways. And we'll talk about some of those ways to mental health and becoming healthy. So, we want to really dive in and understand that, 16% of African Americans report mental health issues. Right. And so that you're talking about, that's a lot of people. Black Americans are 20% more likely to have mental health issues.
Yeah. And basically, I think what that data shows is that, like in most cases, mental health illness affects the Black community more than any other community. But it's also underreported.
Oh, yeah.
And so many of us are suffering from some sort of mental illness. We'll talk about some of those mental illnesses throughout the course of these conversations. Mm-hmm. But imagine 16% reporting mental health. That's about 7 million Americans. Or imagine the number of people who are
not reported. Right.
Exactly.
Oh, yeah.
Exactly.
And that's that. I know that number. We talk about it here. We'll put a shout out for Family Healing Center while we're in here talking about mental illness.
Yeah, and I think the big thing, and you mentioned a minute ago, the reason why it's underreported or not reported is the stigma associated with it.
There's a big time stigma. I mean, we'll talk about that also, right? We just laying that on foundation. And one of the things that we talk about, and it's been new, but we laugh about it, is PTSD, which is post-traumatic stress disorder, and that's most likely to affect the Black community. And the reason why, we're talking about the crime and all of the things that go on in a lot of the inner cities that have affected the Black community, it really is something that we really need to start talking about it. And then if we really think about something that we never really thought we would be talking about, because it used to be a white male thing, is Black suicide.
Right. And believe it or not, suicide is something that we're going to talk about in weeks to come. But let's talk a little bit about the causes. You mentioned PTSD, but there are a few causes that the mental health experts list as far as being the reasons why mental health illness occurs. And one of those at the very top of the list is trauma.
Oh, big time.
And they talk about trauma as being early onset trauma and then post onset trauma. And early onset trauma is the trauma that we go through as children. The things that we see, the things that we experience, the things that happen to us that are traumatic to us, and it leaves us it stays with us, and it stays with us throughout our whole life. And everybody knows somebody who has experienced childhood
traumatized.
Who've experienced childhood trauma.
Yeah.
And it has affected them going forward. And then there's post-trauma, and what that basically is as we get older, as we live life, as we experience life, we wind up also experiencing things that are traumatic to us, and it helps us, not helps us, but it causes us to have some sort of a mental illness.
Yeah, and you know what? And when we talk about the traumatic, post-traumatic, I want to talk about something that I believe that has sometimes even been passed down for generations, is the residues. And I don't care, we can talk about it, debate about it, fight about it, but there's some things that have been handed down for so many generations. The residue of, slavery, the residue of things that have happened 400 years ago. And then we keep going back to 400 years. I just think about from the 1800s to now, that's not 400 years. That's probably about 150 years of things that have just continued to affect our communities. Some of the stuff that, mothers have carried in their wombs to their children. So when we think about the post-traumatic stress disorder, it's something that it literally has been something that's been passed down for years.
It's interesting that you bring that up, because the second list the second reason or cause for most mental health cases, by the way, these are things that are specific to the Black community. The second cause is violence.
Oh, yeah.
And the third cause is police encounters and incarceration. And Malik, you hit it a second ago. The fourth cause is poverty and oppression. And then finally, again, as you mentioned, the whole historical impact of institutional and systemic racism. All these things are things that are part and parcel and specific to the Black community, which causes mental illness in the Black community.
And so when we think about that, we want to start, and again, we want to, we're going to always be solution focused. We want to deal with it because this is the month we're in. And so we're talking about this, and we don't want to paint it as doom and gloom, but we're going to talk about some of the realities, because we haven't talked about this. This has been the big bad boogeyman of so many communities and so many homes,
especially our community.
Right. It was just the crazy uncle locked in the back room, with the TV on all day. And I'm sure we've all had one of those.
Well, you know what? Everybody has somebody in their family. And I remember growing up, some people in my family, oh, he's just crazy. Oh, she's showing out something happened to her. We don't know what's wrong with her. She's just crazy.
Yeah.
But at the end of the day, the bottom line is, in my family, I've had people suffer from mental illness, and we didn't even know it was mental illness.
That's what
until
I said.
10, 15, 20 years later.
Yeah, after the person's gone, because again, it was the person in my family. It was the one when you went over their house, they were just locked in the back room, with the TV on, talking to themselves with a bottle, and they just. That's what we chalked it up as. It's just crazy. And we want to, in every family, I've been to some of my friends' house who got that same experience. So,
and that example you just mentioned is schizophrenia. And we're going to talk about schizophrenia in weeks to come. And we're going to talk about bipolar depression and bipolar 1 in weeks to come. And we're going to talk about depression and anxiety in weeks to come. But I really want to settle in on something that is kind of a new. It's kind of a new mental illness or a new cause, I should say, of mental illness, and that's COVID.
Oh my gosh!
So I just want to take a step back real quick. I had no idea. I had some idea, but I had no idea to the depths that COVID-19 had on the Black community in particular.
Oh my God, grief, loss, death, trauma. You know, when we talk about the grieving process and all of the loss, when we think about when we start to think about how we were isolated, you know, the isolation and loneliness that was caused behind. I mean, people were actually locked in their homes with nowhere to go and afraid. You know, the doom and gloom with the TVs. And then, you know, and it was, if we look at what we were faced with COVID, it was death after death after death. And then it started hitting home and it started hitting our communities. And so we faced one with isolation.
Absolutely.
Which is really dangerous, especially think about people who didn't have families. You know, fortunately for us, we had wives at home and we could, you know, kind of have community, but people who were just lost in loneliness.
Yeah, I want to focus on the isolation piece for a quick second. I never, ever realized how important it was for us to socialize with other people. I never, ever realized how important it was for us to I took relationships for granted.
Oh, yeah.
I took spending time with family, spending time with friends, spending time with neighbors, spending time with coworkers, just spending time out in public. I just took it for granted because it was never taken away from me. And what COVID did, it isolated us and it forced us, and we fell into depression. And we're going to ultimately talk about depression before this episode is over. But we ultimately fell into depression because we did not know how to deal with each other from an isolation standpoint of view.
And then when we think about that, if we really look at, again, it reminded us of how really connected we need to be. Right. And I'm like you, Brett. I mean, seriously, it was like, whoa, I can't be with my friends. You know, we had situations where, you know, hey, meet me on your lawn. You know, when we were used to going out to dinner and doing those things, and it was so impactful, and just understanding that isolation piece and what did it bring on for a lot of people was loneliness, as you just talked about. You know, so both of those things were affected, but more than that, even just the relevance of you know, the security piece of it. You know, the I guess I'm not going to talk about just security, but the fear. Yeah. I think it just drove so much fear, which, you know, broke into our security because we didn't know what was going on.
And uncertainty.
Yeah.
And so when you have uncertainty, you have fear because you're not you're not in control of the situation that you've always been in control with. And obviously what COVID did was it rearranged our routine. It rearranged the normal routine and normal lifestyle or normalcy in our life. And most of us, and especially somebody like me, I need to know what I'm supposed to do, when I'm supposed to do it, where I'm supposed to do it, because I'm a person who lives by way of routine.
Yeah. And one of the other things that it affected for a lot of people that didn't realize it was depression and anxiety and insomnia. Really, because people were used to being on a pattern. They were used to being, you know, going to work, and then their sleep patterns got thrown off in the fear. And a lot of people, I just know even from work, we were having people just tell them, turn off the TV.
Right.
You know, it was pretty powerful. And then, you know, again, we could talk about, you know, the relevance of, where we were in society, where we were with our families. You know, we had family members who wouldn't allow us to come over. You know, I mean, that with a strain, you know, and I'm not going to go there, but with the whole vaccine situation, if you wasn't vaccinated, you couldn't come near me, you know, and all of the things that it did with our communities, you know, but one of the ones I really, we got to deal with, and it's something with COVID that we've dealt with or never really dealt with, which was grief.
Right.
And I want to talk about grief because there were a lot of people who lost loved ones.
Right.
But on a natural state, as African Americans, we don't know how to grieve. As people, we don't know how to grieve. I'm not going to just talk about that, but grief is one of these things where we think, someone dies, we bury them, and these things like depression and or loneliness set in or missing someone, and we just move on. We pour out a little liquor, we go to the funeral, the family gets together, and then we move on. But with grief, we have grieved so hard these last few years.
Right.
I mean, I know several people. I've lost several people that were great friends from 35 on behind this COVID thing, and it hurts.
Yeah, part of the problem with grieving, good grief.
That's it.
Part of the problem with grieving is that typically, traditionally, we need each other to grieve with.
Mm-hmm.
And with COVID, the grieving process became very much of a back to that same word, an isolation process. So
Right.
imagine losing a loved one, not being able to hug another loved one, unless that person lives in your house, and not being able to physically have contact with a group of family members, a group of friends, so that we can grieve together. The grieving process took place on Zoom, and
Big time, brother.
and from a technology standpoint of view, a lot of us weren't all that familiar with how to use Zoom. We had to learn how to use Zoom effectively because it was the way that we communicated with people outside of the four walls that we lived in.
Right. And then let's talk about that also, because when we look at, what grief is, grief is an internal experience to loss. That includes thoughts and feelings that each of us have when someone dies or we move on or we transition. And it's the ability to grieve that stems from our capacity to give and receive love. Now, there's a difference between grief and mourning, because mourning is often heard as interchangeably with grief, but it is different. Mourning is an outward expression of our grief. In other words, it is our shared social responsibility to a loss. In simple terms, mourning is the grief that's gone public. Right. So when we mourn together.
Okay.
Yeah. We mourn together. And then, and we didn't have a chance to do that. And think about some of the loved ones that, we went to a funeral where they had to cremate the person. So it wasn't even a funeral because they weren't allowing you, to just have a body.
Right.
So, it was so much. And I know someone who lost a mom and a dad in a day.
Wow.
Yeah,
that's tough.
Yeah, so we dealt with a lot with the pandemic, and knowing how to deal with the day-to-day changes, again, jobs, and so many people got sent home, and the people started working from home, and
Well, first of all, a lot of people lost their jobs.
Oh, big time.
And not to make this racial, but from a proportional standpoint of view, from a ratio standpoint of view, more black people lost their jobs than any other ethnicity. And so imagine now I don't have a job, and what happens? I lose my apartment. I wind up losing perhaps my house. And that just adds to the overall impact and the effect that COVID had on us mentally and emotionally, again, leading to all kinds of
right. So if I didn't know how to deal with, again, not knowing how to deal with the day-to-day changes of losing a job, losing a business, finances, all of the things that you just talked about, it was tough. And believe it or not, overwhelmingly, the blacks were more affected than any other ethnicity.
Exactly.
Period.
Exactly.
And so we have to understand that, this leads and led to a lot of emotional and mental challenges for Black Americans.
Absolutely. And so the whole COVID thing, and thanks for sharing that, the whole COVID thing kind of leads into the absolute number one, according to the National Institute of Mental Health. What is that? The NI? Yeah, National Institute of Mental Health, the NIMH, the number one mental disorder or mental illness affecting affecting all communities, but particularly the Black community, is what they call clinical depression. And by definition, what clinical depression is a serious mood disorder, and it affects how we think, it affects how we feel, and it affects how we handle our day-to-day activities. Now, what's interesting about this is that to be diagnosed with clinical depression, your symptoms have to persist for about 2 weeks. And so when you have symptoms and they last for more than 2 weeks or 2 weeks or at least 2 weeks, then you can be diagnosed as clinically depressed. And some of just a couple quick statistics that are relative to clinical depression. Black Americans have a higher rate of depression, and it's even worse among Black women. And there's even a higher rate in the LGBTQIA community.
Yep.
And so as a result of that, the stigma, and we talked about stigma before, but the stigma of clinical depression is so much higher in the Black community.
And something is true, because some face the unique factors of depression, which include, it's crazy, exposure to racial trauma, difficult life circumstances due to racism, racial barriers to access of care, including racism and care for providers, and a mental health stigma. So it's something that when we think about what, causes depression in the Black community, that's really a big part of it. And so, some of the signs and symptoms, again, that, and then we talk about the persistent sadness and emptiness, hopelessness.
And I think the biggest thing right there, if you want to look at it really simply, and I know that you want to get into the different signs and the different symptoms, but if you're hopeless, and then you're helpless, where are you going? What are you doing? That's the worst thing you can be, is hopeless and helpless.
Yeah. So when we, and again, and we don't know how to say we're hopeless, right? We don't know how to say
we're helpless.
We're hopeless, or we need help, but we act out big time. And so when we talk about those things, we really looking at, a lot of the, hopelessness, anger, frustration, debility, restlessness, guilt and shame, again, feeling worthless, loss of interest and pleasure, hobbies or activities, decreased energy or fatigue, difficulty focusing on and concentrating, remembering, can't make decisions, withdrawn, isolated, detached. These are real symptoms of depression. And so when we start to understand, and not to say that, that some days I wake up and I'm not feeling great, but again, if that's consistent, if it's things that are continuing to happen, we want to understand what that looks like so that we can begin to help people to get the help they need and to destigmatize it, because people mask it. I know for years, people masked it, with alcoholism, which is something that is a big, big component to mental illness and depression.
Absolutely.
Right. And I'll say, if someone's depressed and they're putting a depressant in their body. Right. And so those are some of the signs of depression that we want to start looking at. Again, if it's persistent sadness, and I wake up one day and I'm sad, but I got 7 days in this and it's consistent, I want to get it checked out.
Yeah. Here's the thing, Blake, you said something very significant that we're not going to, pretty much admit that we're going through this. The reason why we're talking about these signs and symptoms is because most people who are experiencing depression don't even know they're experiencing depression. And so we talk about these lists, we talk about these signs and symptoms because these are the things you need to look for in the person that you're living with, in the person that you're in a relationship with, the person that you have a friendship with. the person that you care about that you're working with, a person that you care about that might be a neighbor, that might be somebody that you're involved with, church or community project. When you see these particular behaviors in somebody, you got to be the one to be able to approach that person in love, and you got to be the one to assist that person in getting help. Because really want to emphasize this. People who are depressed don't know they're depressed. They don't have the cognitive skill set to realize they're depressed. They don't have the one of those, I forgot what it was you said, one of those signs and symptoms is just an inability to function, an inability to perform day-to-day functions. When people don't do that, they slide into, that's a sign of depression.
And you know, some people may think about it, I'm just procrastinating, or I'm doing that. And those are some of the things. But, I want to be real clear that, there's a difference between procrastinating and not getting the job done and really understanding it. And then one of the things, depression is about as prevalent in the Black community as in white ones. The difference is Black people we just face so many different social pressures, and that's what increases our risk for depression. Again, we just talked about it earlier, but some of those social pressures are, hey, I can't find a job. Well, I just lost my job, and I'm not getting one as easy as the white counterparts or whoever. So when we look at that, we really want to understand that. Yeah, okay, you may understand that. Hey, it's prevalent in both communities, but no, it literally is something that as Blacks, we struggle to access treatment. We struggle because it is stigmatized. So we don't even want to talk about it. And, like you said, just walking up to somebody and saying, man, I'm just feeling really hopeless right now.
Right. It's not going to happen. Well, so you know what? That may not be true.
For the most part, bro.
Yeah, I mean, there could obviously there's exceptions to every rule, and I'm sure that there are some people who are aware, who are self-aware enough to realize something's wrong.
Right.
So you talked about losing your job. You talked about maybe having a business that's not doing well, and you talked about life events that happen. Here's the thing. We talked about trauma, and we talked about traumatic events. We talked about things that happen that trigger these feelings. When things happen that trigger you or cause you to not want to wake up, to not want to get up, to not want to get dressed, to not want to do the things that you normally do, when you're withdrawn, when you isolate yourself, when you just don't feel like being a part of anybody, those are serious signs and symptoms of depression. So we want to make sure that you are paying attention to the people next to you. Pay attention to the people around you.
That's good.
Because they don't even realize they're depressed. They just don't even realize it. And so we want to make sure that we're there for them. And that's why we're having this conversation. So I want to talk about treating it real quick.
And then I want to say this too, though. And I read an interesting article just when we were doing, when we were coming up, and it says depression symptoms may also color someone's perception. They may cause people, especially African Americans, to believe that treatment will not work, or that the problem is because of personal failing, not a mental health diagnosis. And then one of the things, and we get ready to talk about treatment, but one of the things that a lot of healthcare providers have failed to do was notice or how to treat Black people. Right now, when we think about this, I always say I'm going to say it. I'm just going to say it. I've been in the field for about 7 to 8 years now. I see, but one of the things that I've noticed is a lot of white Caucasian therapists don't identify or know how to deal with Black trauma and Black pain. I think that is something,
or mental illness in the Black community. Period.
Right. Period. Absolutely. And so I think I'm blessed now because there are a lot more African American American men and women going into field, but a lot more women. I was at a graduation this week, believe it or not, from a whole entire, there were 40 people that graduated with their MSWs. There were 3 men.
Well,
Right?
look,
So-
I think the reason for that is pretty simple. You know, women are nurturers.
Right.
Women are caretakers.
Right.
Women are caregivers.
So again, when we talking about that, there were quite a few African American women, but we still, and I'm putting a plug in for some people who may not want to know what they want to do with their careers. You know, we do need more black male therapists in the field. But so that's just a plug. But anyway, they failed to treat us. They don't know how to treat us, right?
Well, it's the reason why. Okay, excuse me for jumping in, but I'll freak. My memory's not that great.
That's good.
I'll forget this.
Yeah.
The reason why we go untreated is basically, and I'm talking about the black community now.
Yes,
It's two reasons. Reason number one is there's a stigma associated with this, and we don't want to deal with that. Reason number two is there's an inaccessibility to the type of therapist that we want to work with. Mm-hmm. And number three, it goes back to your point. So therefore, we wind up, if we wind up going to a therapist who's very qualified, but isn't culturally sensitive to who we are as black people, and therefore can't necessarily relate to us the way we need to be related to.
Exactly.
And we're not comfortable, so we stop going, or the therapy isn't as effective as it could be. So what happens ultimately is that we are not as effectively treated as our white counterparts, and that's not to be racial or racist.
Yeah,
it's just reality.
I'd say, you know, one of the things that when you do get a really good black therapist, they can heal all pain. Black, white, green. I mean, we just been that way. And, you know, and there are different types of therapists, right? You know, I mean, we want to talk. And just different, you know, there's a difference between a psychologist and psychiatrist. And people don't understand that. You know, I talk to people all the time. They're like, I don't want to go to I don't want nobody giving me medicine. Well, first of all, that's not what, you have to be a psychiatrist to be able to get treated by someone
to
with
be able
medicine.
to prescribe medication. Right. You have to be a licensed psychiatrist.
Right. That's what a doctor is. They're a doctor. They're an MD. Then they're a psychologist, which are more with the mind and all of that. And a lot of psychologists don't do therapy. Psychologists are more with the research and all of those things. And then there are therapists, okay? They're different type. They're licensed professional counselors. They're licensed clinical social workers. They're LMFTs, licensed and marriage family therapists. So there are different type of therapists that you can go through. And so understanding that also, because a lot of times in the community, especially in the black community, they don't know that. You know, they I don't want to go see a shrink. Right. All right. Well, what's a shrink? You know, let's talk about that. So understanding when we're talking about going to get help, know where to go get help at. Yeah. Now, if I'm depressed, maybe I might want to go see a psychiatrist.
Well,
right?
You won't start. You won't start with the psychiatrist.
Right.
Let me back up real quick. You said something a minute ago that's striking to me. Mm-hmm. This is critically important. In the black community, we stigmatize our own because research has shown that black people see their own family members and own friends with mental illness as being weak and as being a failure. Mm-hmm. And this is what studies show. Oh, yeah. This isn't my opinion. This is what studies show. So think about it for a minute.
Yeah. Yeah. My own personal failures.
You're weak because you have a mental illness, and you're a personal failure because you have a mental illness. So what does that do to me?
Right.
What it does to me is it makes me feel like, right back to what we talked about before, shame, guilt, isolation, all that kind of stuff. But what it also does for me is it makes me not want to get treatment. Right. So what I want to really emphasize here is if you care about that person, you won't stigmatize them, number one. if you care about that person, you want to get them to a doctor. And I want to talk real quickly about what treatment is for depression.
Yeah, before you do that, Brad, I want to talk about some myths, because there are a lot of myths around depression too. If depression treatment does not work immediately, it will not work. And we're going to talk
That's a
about
myth.
that. That's a myth,
It's a myth.
right? Medication is the only way of treatment. That's not true.
It's a myth.
It's right. People should be strong enough to overcome depression.
Myth.
Depression is sadness.
Well, that's true, though.
Yeah, in some ways, while many people with depression feel sad, it can also be a cause of anger, physical pain, and changes in mood and life. So we got to understand, okay, because I'm sad, that's one part of it, but that's not the only part. Remember, so if it's continued sadness, we'll deal with that. And then this one is the other one that's real funny, which is a myth. Black people are inherently resilient and do not need therapy.
Well, I don't even know what to say to that. I think that's unfortunate, and I think that anybody who throws that out there, I don't know who throws that out there, but whoever throws that out there is doing black people a disservice. Whoever buys into that is doing themselves a disservice. Mental health is not something that we raise our hand and say, "Hey, yo, I want to be a victim of mental health illness. I want to be depressed. I want to have anxiety. I want to be schizophrenic.
No, we didn't
I
wake
want to
up
be
that way.
bipolar."
Right.
That is not a desired state of emotion. That's not a desired mental state.
Right.
It's something that is an illness, and that's what we're talking about. It's something we can't help. That's why
Right.
we're talking about it. But help is available. And I just want to talk real quickly about the ways to which go about getting help.
Right.
It's sort of,
So some of the ways, again, going to therapy. Therapy can help a person process emotion, right? Cultivate coping skills, help heal relationships, understand the connection between their thoughts and feelings. That's one of the things that therapy does, right? It can help, making lifestyle changes. Many people with depression find that more exercise, right? Helpful changes to their lifestyle of eating, getting quality sleep can help. Those are things we want to deal with. Going to a residential treatment facility, if it gets really bad, go somewhere. People with severe depression may need residential treatment. And all residential treatment is going into a long-term program to get help, to get away maybe from your environment, to help you learn how to cope with these skills. And so really understanding that, looking at alternative therapies, finding support groups, finding acupuncture, doing meditation, doing those things. And then at the end, if you need things like medication, again, if you're going through all of that and feel it's still not working, there are a wide range of drugs to help depression. And again, that's when a psychiatrist comes in involvement to be able to make that determination. And a lot of times the psychologist was working with your therapist, so you're not just going in blind and really doing that. And so understand, some people may need to try medicine. They may need to try the combination of medicines and therapy and changing lifestyle. So those are some of the things that when I think about it, we really should start looking at really going to get the help. You don't have to just live with it.
right. And the typical order of treatment starts with your primary care physician, your family practitioner, your internal medicine doctor, somebody who knows your physical history, and that person who gets an idea of what you're going through because you're having this conversation with them, because you already had that relationship with them, is going to refer you to a therapist or a psychologist. And the primary therapy that the mental health experts talk about is psychotherapy. And there's several types of it. And basically what psychotherapy is having a therapist understand the triggers, the things that trigger you, that cause you to go into your depressive episodes. Remember, we talked about how in order to be considered clinically depressed, you have to have 2 full weeks of some symptom. And what the psychotherapy does is it allows you, it kind of brings you into those areas of your life where you are most oppressed or depressed.
And that when you're talking about finding a therapist, a lot of times we want to understand that you want a culturally competent therapist. You want someone who understands, as you said, you said something very powerful, who understands it, but they have to be culturally competent. And a lot of times that's what's going on. Black people may get the most effective treatment from culturally competent therapists who specialize in Black mental health issues. Right. And so we want to look at that.
Right. So psychotherapy is where you would wind up after your primary care physician. They do this thing called cognitive behavioral therapy. And basically what they try to do is help people to unthink or rethink.
Yes.
Or program themselves to think differently, act differently, and do things differently in their place of depression. And that goes on for an extended period of time. And if that's not working, what the psychotherapist would do is then, as Malik mentioned, refer that particular patient to a psychiatrist. And that psychiatrist, in consultation with the therapist, in consultation with the psychotherapist, will understand what those behaviors are and prescribe antidepressants. And there's a whole lot of different kinds of antidepressants, and they do different things. They work in different ways, but the goal is to have the medicine impact how your brain thinks and how your brain controls your thinking and your behavior. So the psychotherapy on the one hand is a behavioral thing. The medication from psychiatrists is a chemical thing. And usually when you get antidepressants or antipsychotics or any medication to treat mental illness, you're talking about a 4 to 8 week period of time before the medicine is able to effectively have efficacy.
And you know what, Brett? Yeah, talk to that, because I know you for a long time. You were in this arena. I mean, you were in the pharmaceutical business for a long time, and you dealt with a lot of that stuff, right? And so,
psychiatrists were my patients and
your clients.
Excuse me, my clients. And so I would have conversations with them, not about any particular patient, but about how patients presented, and how they presented would allow me to suggest what particular type of antidepressant or antipsychotic that I would offer to the doctor. Because they work differently. They attack different, some inhibit and some, it's been a while, some inhibit and some, the right word is not inspire, but some prohibit and some inhibit. And so you have some things that shut down mechanisms, and you have some medicines that stimulate, that's the word I was looking for, that stimulate brain function. And so the medicine works hand in hand with the therapy, and that's how people get better. Now, one thing I want to add to that as we close this thing out, Malik, unless you have something else to add to this, is that, there's also, I've also worked in these institutions that you talked about, where you have some very serious patients, and there are brain stimulation therapies that take place that are beyond your oral medications. But these are
they're starting to be. I know for. I'm glad you spoke about that, because there are some new modalities now that are doing brain stimulation that are proven effective. Also,
yeah.
And I'm glad you mentioned that. That is so true. Yeah, because we have one of our reps who came in, who works for one of the people we service. One of our people we service, they told us about that brain stimulation, and it's supposed to be working. It's supposed to be something that it's helping. So yeah. But again, you want to be able to get to the healthcare provider, get to the person who can really definitely help, and be able to do that.
Yeah, and last piece for me, anyway, is that this brain stimulation, this is for your most severe patients. It's not for somebody who's mild to moderate. It's not for somebody who's being managed. It's not even for somebody who's being ineffectively managed. This is last resort for severe patients only. And basically, it's basically they just use electricity to activate. That's the word I was looking for, to activate and inhibit the brain. And so hopefully we don't get to that point. We're having these conversations so that you or nobody you know or care about or love has to get to that point. So that's that's
Yeah,
it.
it's called actually I'm giving it it's transcranial magnetic stimulation. And what transcranial, not transcranial magnetic stimulation is a procedure that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of major depression. It's called a non-invasive procedure because it is done without surgical or cutting of the skin. It has been approved by the FDA, so that's something that you may want to look at.
Yeah,
right.
absolutely.
And so that's something that's new. I mean, in closing, man, I do want to encourage anyone who may be listening or know someone to go get help. They're not crazy. We gotta get away from that that stigma. First of all, I want to drill home people who are suffering. They're not crazy. And again, when we're doing that, we're deterring them from seeking help because we're calling them crazy, right? And so it's not their fault. They're not weak. They don't need to feel embarrassed because you're leaning on them for support. Let them know you're here, you care. And so those are some of the things that we really want to talk about. And then also, I want to put a plug in. I know we're going to be dealing with this in the next few episodes. Is if you're depressed, don't be putting any stimulants that have not been prescribed for you in your body. Okay. I do know a lot of people who are depressed who drink alcohol. It makes you more depressed because you're putting a stimulant in your body. And also, I know a lot of people who've come in here and said, well, can I just smoke a little marijuana? And no, it's a depressant. So you want to take something that's making you're already down, and you want to put something in your body that's making you more down. Now, I'm not a advocate. I mean, I'm not a doctor. I know there's some medical marijuana cards out here that shouldn't be out here, but that's another story. But, let's really understand, that depression can cause intense sadness, but it can also trigger other symptoms. So knowing that, if you are, a loved one suffering, go get them some help. Let's not just believe this thing and believe that, many people with this condition believe that their case is hopeless. It's not. You can get treatment, and with the right care, people, even with the most severe depression, can feel better. And again, we're here. And go out, help someone that needs help. Encourage them to go to counseling. Be an ear for them. Do those things. But encourage them to seek help. Again, we want to thank you for another episode of Men to Men podcast. Again, we can be reached on Instagram at Men to Men podcast. We also can be reached at Facebook, Men to Men podcast, YouTube, and also SoundCloud. Well, thank you for another great week of great conversation, Brett. And we'll see you guys next week.